Yes. Oh.
Do you know who Peggy Lee is?
No.
No, you don't?
I don't. Is it Peggy from Family, the Family Show?
Married with Children?
Married with Children?
No.
Oh.
She kind of looks like her though, but I'm just gonna spit some.
Okay.
I'm gonna spit some rhymes from Peggy Lee.
Okay. Oh, so this is a singer.
This is a singer. Okay. It's a lyricist. Mm-hmm. I can wash out 44 pairs of socks and have them hanging out on the line.
Good for you, girlfriend.
I could starch and iron 24 shirts. For you count from 1 to 9.
That's a lie, but okay.
I can scoop up a great big dipper full of lard from the drippings can.
You fried some chicken? Peggy?
Throw it in the skillet. Go out and do my shopping. Be back before it melts in the pan.
What kind of foolishness are you?
'Cause I'm a woman.
Oh my gosh.
WOMAN.
Oh, this is the song you sing before?
I say it again. This episode is dedicated to one Miss Peggy Lee.
Oh,
this
my
one's
gosh.
for you. I'm sure she's dead by now, though.
Probably.
But
you should have looked that up while you looked up the lyrics.
She was one hell of a woman.
Oh, okay. To do all that, you damn bet she was.
She sure was.
I got that dish. I got that. I got that dish. 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 I got that dish. I got that. I got that dish.
Hey y'all, it's Onika.
And it's your girl B.
And you are dishing with Dainty Dish. How you doing today, B?
Girl, I'm here. I'm happy.
You're happy?
I'm cheerful. Good vibes,
because
good vibes.
I'm clap along if you feel like a room without a roof. Because I'm happy. Clap along if you know that happiness is the truth.
How about you?
Happy.
You're happy too?
Happy.
Oh, that's an extra piece of happy.
Oh, I got some news, but you know, my listeners know I have a big mouth.
We don't talk about
I'm the mouth of the North.
For
not
all,
even the
for
mouth
all
of the South.
No bad mind people, we don't talk about our good news.
No, not until it's
completely come to fruition.
Yeah, it's solidified. We don't want to jinx it. But the Dainty sisters are taking over. That's all I have to say.
We're
good luck. Good luck to all the haters. If you are not on Team Bianca, Team Monica, and of course Elliot's here too. So
if you're not on these teams, you're not on the right team.
You're
right
on the
now.
right teams right now. I got a really big team, Drake. But we're not here to talk about Drake today. I'm doing okay. You asked me how I was doing, right?
I did.
I'm doing good.
We're happy.
I've been doing the workout. Chloe Ting. I started the 2-week shred.
Oh my gosh!
Which I asked you to do with me.
I've started.
And you did the first day 1 video of the 3. She was complaining during the warm.
First of all, I did day 1. Day 2 was a little hectic. Okay, don't shame me.
She came strolling around the corner at my parents' condo. I came setting up in the backyard, ready to do my thing, and this girl just strolling in.
Better to appear than not to appear at all.
That's true. It's better to have loved than lost.
Yeah.
So she did a quarter of a video today. So let's see how much she does.
And first of all, you don't get to shave me. You don't get to shave me actually.
What?
Because you guys want to know what this girl did this week. My sensible sister that has no common sense.
So, you know what?
So with this Chloe,
was an honest mistake.
So with this Chloe thing, she's trying to eat right and do all the things that she's supposed to do, and she's calculating her calories and all these things. So she decided that she's gonna boil some eggs. Okay, guys. So I get a phone call while I'm in bed trying to put my child to sleep, and this girl is like, she calls me and doesn't say anything. So I'm like, hello, quietly trying not to wake up my child. And I get up now and look for her in the house because she's in the house. So I'm like, oh, okay. I look, she's in the bathroom. She's sitting in the bathroom. And I'm like, what are you doing? You just called me. No, I didn't call you. I'm like, okay, cool. So I left. I'm like, you did, but okay, cool. So I left, and she comes back out after like 5 minutes and she goes, okay, I did call you. I wanted to ask you a question. So I'm like, what? She goes, so I put 6 eggs in the pot and I just want to know how long it's going to take to boil all 6, because I'm here trying to figure out the math on how long it's going to take to boil all 6. Now, I have heard of this riddle many of years ago, so I knew the answer to this question, but I decided to bring it to our mother. So I said, come. So we went to our mother. With the finger. I said, come. So we went to our mom, and I reworded what she asked me to make her look worse. So I said, Mom, how long does it take to boil 6 eggs in the same pot? And my mom says, the same time it would take to boil 1. And I said, well, yeah, I knew that, but your daughter didn't. So but
here's the thing, because I've never boiled 6 eggs before. Okay,
I really should have just told her 6 minutes per egg.
The thing of it is, when I boil,
should have been there for an hour.
When I boil 2 eggs, I boil it for 15 minutes.
But when she boils 1,
but when I boil 1, I boil it for 8 minutes.
Okay,
right? so I double up the time, but I think our listeners could do the math on that. No common sense whatsoever, guys. Whatever.
Well, so. You don't get to shame me. Don't,
you know what? Don't come for me. Like,
don't come for me unless I send for you.
My listeners out there, if anyone doesn't know how to boil an egg, apparently, like I can't. I want to hear from you. I want to hear about your egg boiling.
Don't encourage her.
Your egg boiling mishaps, because I'm sure there's a lot of people out there that would have asked the same question in the same manner as I did, and I want to hear from you. So we'll give you our info at the end of the show. My eyes are burning. Elle, do me a favor. Can you grab a Kleenex? I'm just, I get dry eye. It's hot in here. Maybe a paper towel from the kitchen. I'm really telling you, I'm just like in this. I feel like I just want to be in their living rooms right now. So I'm like, you're in my living room. But yeah, it's just really hot in here, and it was rainy outside and it was gross. But other than that, this is the longest check-in that we've ever had, it feels like. Thank you, Elle. Mm-hmm. But I'm good. And today I wanted us to have a conversation about how the pandemic is affecting women. That's why I quoted that Peggy Lee, dropped those lyrics at the beginning of the show. Because I am a woman, you are a woman, Elliot is a man. So that is why he is not on the mic today. I invited him, but he declined.
He passed. He was wise with the choice and said, you know what, I don't want anything to come back if I say anything.
I don't want any blowback.
No.
I don't want any blowback.
It's all right. It's like, we feel you.
Oh my gosh. So yeah, how the pandemic is affecting women, because apparently it's affecting women a lot differently than it's affecting men. And I don't think that people are necessarily realizing it because we're so caught up in the pandemic of itself.
So many changes are happening behind the scene, guys. Get involved.
Yeah,
get in the know.
Sorry, I had a cough. So, yeah. So we're gonna start off obviously with our very, very, very fun, flashy and favorites. Newsflash.
It's always fun to say it.
It's always fun. It's always fun.
No recording. No pre-recording for you guys, just so you're well aware.
Genuine and authentic.
It's all from the gut. From the heart. From the diaphragm.
Yeah. Mm-hmm. From the jugular. Federal officials are probing ways to address impact of the coronavirus pandemic on women. This is a May 23rd article. So this is just going back to as far as, because as we all know, the timeline of COVID, May 13th, onwards, it's been a complete shit show. Mm-hmm. So according to this in May, they were trying to figure out some recovery efforts that could help women get back to work, earning more money and securing stable jobs, which sounds so lovely.
Oh, of course. It always does.
So, but here's the fact of the matter. Women have seen proportionately steeper job losses than men and are more often in part-time work as well as in sectors that were affected early on in the pandemic. Statistics, I hate that word. Statistics Canada reported this month that 1.5 million women lost their jobs from March and April, and there was a 17% drop in employment from February's levels. So just from February to March, April, 17%. Over 1 million women lost their jobs.
That's crazy. But that, you know that was gonna happen because the kids were out of school, like, you know, like that, and it happened just as March break like came. So parents would have maybe had a week's leave, you know, vacation time if they took it, if they had that type of thing at their jobs, and then had to have taken more leave.
Yeah, but this is true. Yeah. But this is kind of exposed, you know, the whole problem
and how unprepared
that we are for this, and the underlying problems that we had even before the pandemic happened. So they were talking about the fact that women are more often employed in marginal jobs. They tend to make less money than men do, and they represent a vast majority of healthcare, childcare, and elder care workers.
Mm-hmm.
So
like
these are our essential workers.
Yeah.
So
how did these women lose their jobs?
It's not even
the cutbacks,
because you're not thinking about essential workers. Think about all the women that are in retail, for instance.
Yep. Okay.
Apparently, I think there's a number that I have written down somewhere. It was like almost 300,000 jobs were lost in retail for women alone. Even when I worked in retail, the majority of the staff, and it still is because I'm still in contact with people I worked with. Hey, Shelby. So, you know, the staff majority is female. Mm-hmm. So they all lost, you know, either their wages were cut, they were, everything was shut down, so they weren't working. Mm-hmm. I know some of them there was like a pay situation going on for a temporary time being, but after that, they're left in the dust. But the healthcare workers, you know, they're out there. They're essential workers. They're doing their thing. How do we think this pandemic is now going to affect people like that? Deaths, sickness, illness, stress, they're thinking about child care, you know, like. Yeah,
because they are not able to go home to their kids, a lot of them. They have to quarantine themselves and all types of things.
Yeah, so. Jennifer Robson, shout out to Jen Robson. Sorry to shorten your name, but I shortened everyone's name. A social policy expert from Carleton University, my alma mater, says temporary layoffs and reduced hours could quickly turn into permanent layoffs if businesses are not ready to reopen, but parents don't, or if businesses are ready to reopen and parents don't have childcare and can't go back.
Mm-hmm. That's the main concern, and as we discussed before, like, it's not safe to send these children back to these environments. Like, we understand some people have to, and like those are smaller daycares most likely, so they could tend to a small amount of children and keep a cleanly environment for them. But on a wide scale, when it comes to daycares, like a lot of them aren't going to be able to upkeep
and to handle the volume of kids the
cleanliness and everything.
And they're talking about opening up different spaces to make them into daycares that are sanitary and cleanly, but that all is going to take time. Obviously, that's not happening like yesterday. You know? So when we need this stuff to happen, it also mentioned that 40% of household incomes come from Canadian moms, which is an important part of the economy, obviously, and women make up about half of Canada's workforce. So mathematically, it's impossible to get things back to normal without women going back to work. So I read this one article and I didn't want to, because I'm not a feminist. That's not my thing. It's never been my thing.
Sorry.
I don't pee standing up, so I don't think men can do everything that women can do and women can do everything that men can do. Like, I'm not that girl, you know, like, I can't piss standing up. I can piss squatting. I've done it several times in many different places. But, you know, I'm just saying to you that I'm not a feminist, right?
Oh, my God.
The article was saying that we're going to be thrown back to the 1950s.
Yes, World War I.
Because at the end of the day, like World War I, pre-World War I conditions, because at the end of the day, like, women are making up 40%, men are clearly making up 60%. So if men are making the 60%, are they going back into work, or are they staying home and raising the kids? Some people are fair, and I'm not knocking dads, because I know there are some dads that will stay at home with their kids.
Take paternity leave.
But the likelihood is you're either an equal earner or maybe your wife makes more money than you. Like, that's a fair assumption on my part. I don't know your lifestyles, dads out there listening.
Or you just like to be home with the kids.
Or you like to be home with the kids, but the majority of the child care, the education, the everything has fallen on.
Do you know what's funny? I actually seen a little statistic meme on the internet. A statistic meme, because I don't believe it was true. But they say that men do most of the housework, the child rearing, and like the day-to-day things that women normally used to do. Like they do it mostly now. And I don't believe it, but I mean, hey.
Well, we're
modern.
I mean,
some modern time. I don't believe it.
I mean,
there must be some, right? That's why I said like this. There has to be no truth. I didn't take time to Google because I figured it was a lie. But I mean, I'm not knocking the dads that do. But I mean, we're going back. We're definitely going back to 1950 times.
And there's this. I just have to say this. I'm sorry, Miriam Monsef. She's a women and gender equality minister. I can appreciate all that you do for women and gender equality, but I'm not a fan of there's no recovery without a She-Covery and no She-Covery without childcare. Don't do that. Don't do that. It's recovery. Like, just don't do that. Don't make it into this like.
Don't make it to his story and she's story,
she's
like,
story, and his versus her. We're all in this together.
That doesn't really shout gender equality. To be honest,
like, don't separate us from the packs. Like, we're all in this together. Like, married couples have to figure out what they're going to do with their children, and if they so choose to to decide that the woman will stay at home and do the 1960s thing. That's the choices that they make. Or maybe it will be like the meme that Bianca talked about, and it'll be the men at home doing the house cleaning and all the other stuff, because this world has been turned upside the F down. Like, we don't know what people are up to in their homes right now. We don't know, now that things are opening up again. Yes, it's going to look different. It's going to feel different than it used to, so
for a while.
Yeah.
So these.
Yeah. So this is on August 5th. That was the end of that one. This is an August 5th, 2020 article. Women hit hardest by mental health effects of pandemic, and there may be more trouble ahead. So it's saying that we're feeling better about our mental health than at the peak of the pandemic, but major problems might be lurking on the horizon, according to two news reports. So one's from, I always say this, Murnau Chappelle, released the latest monthly snapshot of the country's mental health picture on Wednesday, which would have been August, whatever, based on an online survey of 3,000 Canadians. So they have basically a mental health matrix. It shows that while depression, anxiety, optimism, work productivity, and isolation remain much more significantly concern to people than they were before COVID, Canadians registered some improvement in each category between June and July. So we got hopeful. Got hopeful. I think with the opening up of everything, and we got hopeful, but the latest with reality check. The latest point may be particularly worrying, which, taken in conjunction with the mounting evidence that economic fallout of the pandemic is affecting women more than men. So that's great that everyone's feeling great in June and July, but what are women going through during this time? Because it is showing that the fallout is affecting us more than it's affecting men. They're calling, and this is another, I'm sure, feminist term, probably by the same lady that I just quoted. She-session. She probably thought of it. I'm sure she did. She-session instead of recession. So it's been dubbed the she-session. So we're not in a recession. We're in a she-session.
Just, guys, get it together.
Yeah, it's just the burden it's saying has been placed on women to do everything.
But the burden's always been placed on women to do everything. Is this really?
No,
I mean, the only next
at least
burden,
you had help.
Like, now we have to be teachers.
Like, at least you had help.
I guess, yeah. We have to be like teachers and like full-time child rearers.
Which throws
It's
us back to
exhausting.
where
Yeah.
that goes back to the whole feminist point.
I'm yelling
like,
at my 1-year-old at least like 6 times a day. And,
Like,
and
yeah,
she
it's-
hasn't been on this earth pretty long. So
you need childcare.
I wish I could have some childcare right now. I mean, but soon it shall come in due time.
So
After this COVID thing, because none of my kids are going to school or any type of childcare during this COVID thing. Like, I need them to like spray some sanitization over the whole nation,
Lord,
all
stop
up in the
madness.
buildings and everything before my
Stop
child
madness.
walks up in there and COVID is gone. Free at last.
Free at last.
Free at
Thank
last.
God Almighty, we're free at last.
God Almighty, we are COVID free at last.
Yes,
That is-
amen.
that is the only
Hallelujah.
time.
Praise God.
That is the only time.
So another news report, this one from business consulting behemoth, Deloitte, found that more than 2/3 of the jobs lost in Canada during the pandemic were held by women. Women are at the epicenter of the human impact of COVID-19. So not the economic impact or the health impact, the human impact. Women are being affected on a human level, and by human level they mean physically, mentally,
emotionally,
and
you know,
financially, spiritually, all the lees, like all the lees. So it's
it's a real switch up, that we're not going to be compensated for, people, and we know it, and it's stressful.
They forecast that Canada, that's Deloitte, is forecasting that Canada will see an increase in mental illness, of course, that will last years beyond the pandemic, with women again being disproportionately affected.
Could you imagine the women that have like 4 or 5 kids
Oh my
and they're
gosh.
not going to school and they can't go to work? Do you know? Let me tell you something. Like, because when my eldest was little, I used to have like 2 jobs, okay, and those jobs were breaks for my child. It sounds terrible to some, but the mothers know what I'm talking about. It's a break when they go to school from 9 to 3, and if we're working and they have a little daycare till 6 o'clock.
Yeah, it's one big babysitting rink. Like, basically, that's what schools, in my mind, at least going through it as a child and a teenager, that's what it was. Like, it was a break away from my parents, and my parents, for them, it was a break away from me.
Yeah,
Like,
that is what it is.
so, I don't know. Back to this whole Deloitte thing. They were saying 54 to 163% higher in regards to visits to doctors for mental health issues before 2020. 54 to 163% higher.
Oh, I hate when they go over the hundreds. That's
Just 54 to 100, a range that equals between 6.3 million and 10.7 Canadians. I don't know what that doesn't make sense.
yeah.
I
They
think
clearly
mean
got
6
their
point-
math
they got
wrong.
their math wrong.
Yeah.
6.3 million more people.
Mm-hmm.
Yeah, so I mean that is what it is. Like, this is what we're going through, and how many of those people are going to be women? Like,
We're not going to win with this one. Nobody's really going to win with this one. It's kind of just a grand old shit show, for being honest. But like, what is going to like?
I just found this was really interesting. Actually, I found this interesting website called the Canadian Women's Foundation for National Opinions Survey. So it's basically the Canadian Women's Foundation. They did a national opinion survey in July 2020, and it just goes through like basically how this pandemic is affecting women. I just wanted to share some of the things that they were talking about on this website. So they talk about the fact that there's an increase in gender-based violence. There's a decrease in economic security.
Of course, yeah.
There may or may not be an increase in girls' empowerment. because that one I want to unflesh that one a little bit. And there's inclusivity in leadership, because I found out we have 10 healthcare officers, or not ministers. What's the word I'm looking for?
Well, you're gonna tell us. Officers? Was it
I think
not
it's
officers?
Mrs. Tam is the one that's always on the news.
Oh,
You know, her position. There's 10
first
of
of
them.
all, only CNN gets played at home, so
You don't watch
I barely catch a glimpse of CP24 or Trump and our people, or not Trump. Sorry, CNN, Trudeau and our people. I barely catch it. So it's when we read the news flashes.
Okay.
But I know who you're talking about, though.
Yeah.
The one that talks like she has sense on the yeah, I know which one you're talking about. The one that they try to hail up like, oh, she's talking like she knows what she's talking about. She does.
She sounds very learned. I'll get her name later. It's somewhere in here. So we've been saying, and I know we've said it several times already on the episode, that the pandemic is affecting women differently than it's affecting men, and we've also given some examples. But there are just a couple more examples that I would like to share, and then I'd like us to discuss. So, according to the Public Health Agency of Canada, more women have been diagnosed with COVID-19 than men, and more women have died as a result. This could be due to the high number of women living in nursing homes and senior residences. So we didn't even touch upon the healthcare workers that are living in the nursing homes, the staff.
That is a lot of women.
A lot of women. Like, so we're dying at and there's a black fact. I'm going to call it a black fact.
We have our lives mattering fact.
Yeah. We have a black fact coming up later. So yeah, like a higher number of COVID deaths they've been reported in nursing homes. This could be due to the factors such as the high ratio of women who work in the front line of healthcare services, caregiving, cleaning, and essential roles where workers are high risk of contracting the virus. The virus.
I really didn't even think about the nursing homes. We're talking about like the workers and people in the workforce, but like, oh my gosh, not granny.
Yeah, so we'll get to talking about the increase, and we've talked about it before, about the increased risk of gender-based violence. How I think it's like France, the UK, and like England or something have a high rate right now, like triple the rate of domestic violence calls going on.
Oh yeah, well everybody's home, right?
Yeah, everybody's home.
I felt for the children as soon as this stuff started. I was like, all these kids that used to get escaped from home.
And
from
the
that type of thing,
the arguments,
yeah, they're right in the middle of it, and they
yeah.
have nowhere to go, no camps, no school, no nothing,
no parks. Well, things have opened up, so more economic stress, increased burden of caregiving and housework, and reduced access to support services. So these are the things that are the key gender factors that impact women. So some of the communities they were talking about that are affected, and we don't think about, sometimes we don't think outside of ourselves and outside of what we're going through.
No, not at all. I could admit that.
Culturally, like I'm a Guyanese Canadian, well, not Canadian, but Guyanese woman living in Canada who's grown up in like a Guyanese household. So like when my dad sits around and watches Guyanese news, that's like, oh, what's going on in Guyana? I'm interested. That's my culture. That's my people. That's like whatever. But like, you don't know what everyone else is going through and their experiences. And I was shocked to see some of the things that I saw when I was doing my research. So it was talking about the First Nation, Métis, and Inuit communities.
Which we dare forget all the time. Like the main people of this nation.
People of this nation. So Canada's history of colonialism has meant that many Indigenous communities experience a number of barriers to health and safety, including overcrowding, isolation, decline in infrastructure, limited internet access, etc. So Indigenous women and girls also face a higher risk of gender-based violence, which can be exacerbated by isolation measures. So most of the reserves that are, at least many of the indigenous communities, have closed their borders to prevent the spread of COVID-19. And it's a disproportionate amount of risk for them because, like they're saying, these young women and young girls
can't run away or
can't get away
leave the situation because they're
so they have a lot of other things to worry about.
This is a really sad
of COVID.
episode. Like,
I know it's not fun. It's not fun stuff. Like, I didn't know as a woman, like it's affected me. Like, there's a portion here talking about women and disability, not mental but physical. But it's affected me mentally to the point where I'm living at my parents' house right now. Like, I can't stand being in my own apartment by myself. Mm-hmm. Like, I'll crawl up the walls. I'll get depressed. I'll end up doing something horrible. Like, I just like moved in with you guys. So I have company. Basically. I exercise. I do all these things now. Like, I'm active and I'm dealing with the COVID situation. But I was in one of what they call, there's the 5 C's. And I'm not going to say what the 5 C's are until I get to the 5 C's because it's like caring something, the different professions that women are in. Mm-hmm. But I'm in the caring profession with healthcare. So that's how it has affected me. Like, I lost my job in a situation where it's like it's mental health, right? And that should be considered an essential service. And unfortunately,
it's not.
It is not, which is very troubling. And because I'm in a caring profession, I lost my position. And a lot of women are in these positions. These 5C jobs are basically jobs that, women are losing
at a rapid rate.
Yeah. So the East Asian community, with the spread of COVID-19, people in Canada's East Asia communities begin to experience more racism. Because you have to remember, everyone thinks this originated in China.
And that's because of Trump with his, nonsense. his nonsense. His foolish grammatical errors of what he calls COVID.
Yeah, so
and
people
the ignorant
are thinking,
people that believe it.
Yeah, that it originated some, Chinese, like, supermarket, or not supermarket, market with a pig and a bat or something ridiculous. I don't know what the story was in the beginning, but it was nonsense. It was just nonsense. It was not realistic. Like, we don't know how it happened. We don't know who, patient zero is. Like, we don't know any of that stuff. So pointing fingers, I mean, come on.
Playing the name blame game is not the thing.
Exactly.
To do.
But business owners reported customers were coming in. There were fewer customers coming in due to the stigma around the illness. Mm-hmm. So that's how
I passed a couple of nail salons when COVID first bust. I felt so bad. I'm like, I do want my nails done,
but yeah.
I'm like, I know you guys don't have COVID. Like, we're in Canada. Like, you're okay.
Yeah, you're fine. You're not.
I just don't want the stigma when I come out of your establishment.
Exactly. There's so many factors in making that decision.
Yeah, my anxiety takes me to a whole nother level with the thought process. So I'm not being racist. I'm being cautious.
You're being cautious. So in the Black communities, it's saying in some areas of the United States, coronavirus death rate has been disproportionately high in the African American communities. Which is linked to the systemic barriers to healthcare and economic opportunities. Which, I mean, don't we know it? Like,
I mean, I feel like that is a great contributing factor, but we're also scared of the doctor. Like, not me specifically,
we don't go to doctors.
The Black community is terribly afraid of doctors, especially African American men. So,
if they're kind of like, our Uncle Eddie thought that he might have it. And he just was like,
I'll quarantine for 14 days.
I'll be fine. He's like 90 years old, and he won't go to a doctor. Like, he's 90.
He's like, I got the COVID.
He's just living on a wink and a prayer, like a wink and a prayer.
Give me a blanket and give me 14 days. I'll be good.
Give me some chicken soup. I'm good. I'm fine. Right. So that's just a perfect example. Women living with disabilities. So their inability to practice social distancing, because if they need a caregiver to help them with their physical stuff, and it's different caregivers coming in and coming out, like, they don't have the ability to do the social distancing thing or the isolation thing, which is what we know helps bring the levels of death down. So,
of contracting the virus down.
or death, whatever.
Yeah.
Contracting the virus, you know what I mean.
That first.
That first. Contracting the virus
Death
first,
later.
death next. Senior and elderly women, again, so many outbreaks in long-term care homes in Canada have highlighted the systemic gap that seniors and elderly women may face in such facilities, particularly related to the adequate or inadequate staffing and other oversights.
You know what my thing is with the nursing homes that I
hate
haven't
nursing
liked
homes.
is
I
that,
hate
yeah,
nursing
like I
homes.
hate nursing homes, and like it made me so sad when they like basically closed the borders on nursing homes. Like they just closed the front door and they're like,
You can't
nobody
leave,
can get
you can't
in
leave.
and you can't leave. And like people were coming at, nursing home windows to talk to their family members. And it was just so depressing. I'd see the videos and the pictures and I just like silently shed a tear. Cause like, could you imagine if our grandparents were still alive? Not that they'd be in nursing homes. They would never be in nursing
They would
homes. Black people
die
don't
in
do
their
nursing homes,
beds. We
sorry.
don't do nursing homes.
Like something real dramatic
I might joke
has to
about Papa
happen,
Dainty,
but like,
but I'm not
no,
even
we
joking about
don't.
that for
we
real.
don't. Yeah. So.
Like, no.
But like, yeah, it's really sad.
Yeah, and apparently, like,
And just to sit there and think you might possibly die from the COVID.
oh my gosh, it's awful. I don't even think about it. Possibly, it was saying that 71% of family members are concerned about the long-term care facilities, and they're, as it stands today, they're concerned about them because this is where, like, we're seeing a lot of COVID activity.
Mm-hmm.
We're seeing a lot of COVID activity, right? So they're concerned about it, and I get that.
And then they can't see their family members. They don't hear from their family members, on a regular basis if they don't call. Like our aunt would have to call the hospital to hear anything about anything because nobody would call. So we know that experience. So that's with a nursing home, it's even worse. Like you can't go and visit your family member. You have to basically put your trust in the caretakers who already have so much on their plate with this going on and how the social distancing and everything has to be in there. You have to trust and believe that they're taking care of your people. So I can understand where the
concern comes from.
The concern at such a high rate comes from. Yeah.
So I wanted to go back to the gender-based violence and how the COVID pandemic is related to the increase in gender-based violence.
Girl, come on.
We know, but let's go over it again. The COVID pandemic is linked to spikes in domestic violence report crises in China, France, and the UK. That's the three countries: China,
Really?
France, and the UK. So it apparently echoes what has happened in the past disease outbreaks. So this is not uncommon for the Europe, Asian area.
Wow.
Yeah,
I never knew. So when the
I feel
bubonic
like
plague came out, they were beating each other and say,
They're beating us.
It's just
just
name. Okay.
they're just there's been a spike. There's been a significant spike.
I always figured, like, especially when this started, like there would be domestic spikes. Like imagine you're in an abusive relationship and all of a sudden it's like you're staying with this person on a consecutive basis, like all day, every day. You're not working, they're not working, they have to see you, they get angry. Like that's a lot. Mm-hmm. So that would cause a spike. I could imagine some phone calls.
And apparently, in Canadian shelters, they've sounded the alarms. Like they've said that there's a increased risk of violence. And it was saying that for example, 20% of the 70 shelters it represents for the Ontario Association of Interval and Transitional Houses have had an increased crisis call during the pandemic. So it's not just like happening across seas and we don't like it's everywhere. This is going on. This is just another piece of shit that women have to deal with. Like,
and you can't escape because of COVID.
Apparently 1 in 10 women is very to extremely concerned about the possibility of violence in their home, suggests Statistics Canada. And 71% of Canadians say they're concerned that women are at risk for experiencing violence due to home isolation.
Wow. 71%.
But the fact the fact that killed me, that literally broke my heart, because I just want to, before I even say this point, I just want to say to everyone out there, we need to respect the fact that as much as COVID has taken away from us, it has also opened our eyes to a lot of things.
Very true.
Do you know what I'm saying to you now? It has opened our eyes to some of the greatest and deepest injustices
and problems
in our
households.
systems, in our education system, in our healthcare system, in our economy, in our everyday lives. It is it's like a wound that's been building that's just opened. And here we are with everything. And the fact that I wanted to share with you. Rates of gender-based violence were high in Canada even before the pandemic. On average, every 6 days, a woman is killed by her intimate partner. Every 6 days. That was before COVID happened. So what's going on now after COVID has happened? It sickens me. It sickens me. Like this, I just want all the male listeners to know out there, I love good men. I don't care about the bad ones. I can throw them away with the trash. The good men out there know that I'm not addressing you when I'm talking about the suffering of women. I'm addressing the ones out there that are causing the suffering of women. Whether it's the government, whether it's the healthcare system, whether it's COVID, whether it's whatever.
All the men in power and not in power that could still do something. That's who we're talking to.
Yeah. Basically. So I just want, I want you to, this is all love as what's his name again?
Who?
Joe Budden would say it's
all love.
It's all love. It's coming from a place of love. So the risk factors already exist in the home, they're saying, basically. So the controllingness, possessive jealousy, misogynistic attitude, like various pandemic-related stressors, though, can bring on triggers. So your job loss and reduce of income. Food insecurity, so you can't buy food. Fears about contracting the virus. Exacerbated mental health issues, so if you already have mental health issues going in there. Disrupted family routines, services, and resources. So like things like childcare. So you're just in your house with someone, and we have said this on this podcast before. I can't remember when we said this, but you're in your house with someone you don't even like.
I was just saying that.
Like,
yeah. Well, we have said it before today, but it's true.
You don't even like them, and you're in the house with them, and
you guys used to pass each other like two trains in the night,
two ships, like. You know, you had the kids between you, you had jobs between you, had mortgages between you, and now all of that's just fallen to hell. And you just have each other, and this is what is, for some people, the results. Quarantine and isolation means the abuser and those they harm are in close proximity around the clock. And people aren't around to see the signs of violence and intervene. So that's another huge problem.
Something so funny. I just got a news report from CTV News on my phone that says a new COVID outbreak declared in Manitoba care home. So, could you imagine just how often a new outbreak happens in a nursing home? Just to go back to that fact, that's just crazy. I thought that was weird that came up on my phone.
It's crazy.
They're listening.
They're listening to us right now.
The ears are listening.
They're listening. So how's it COVID affecting women in the front lines? So the three areas or industries with the highest ratio of women versus men in Canada are healthcare, social assistance, healthcare and social assistance, 82.4% women, educational services, 69.3% women, and accommodations and food services, 58.5% women.
That's true.
That's Canada.
I feel like that accommodations and food services is a little bit a little bit higher than 58%. But okay.
Yeah, in 2015, around 56% of women were employed in occupations involving the 5 C's. Here they are.
Talk
caring,
the things.
clerical, catering, cashiering, and cleaning.
Oh, I was in multiple of those C's.
I've been in caring, I've been in catering, cashiering, and that's it.
I've been in all 5 except
Well,
caring. Have I cared for anybody?
Your children.
Well, yeah. So I've been in all 5. I'm a super mom. That's what I base it off of. Oh.
Yeah, so these 5 C's are the professions that women are most often found in, and they're also the ones that have suffered the most because of the pandemic.
Yeah, with everything closing down, everything shutting down, jobs being limited.
And this is another fun fact I didn't think about as a person.
Is it really fun? Because you sounded...
No, I say it with dripping with sarcasm.
Okay.
Oozing with sarcasm.
Fair enough.
So here's a fun fact I figured out or learned along my journey through the pandemic and women. PPE, personal protective equipment, made for men. By
Gloves.
men.
Gloves. Masks. Eye goggles. Face shields. All for you, men.
Gowns. All
How does it feel, Elle? How does it feel to be catered to in such a fashion?
No. It was
I knew my mask didn't fit me properly.
Yes, it said the gender bias in the design of personal protective equipment may make it less effective for women and hamper their work. The equipment is designed with men's bodies and proportions in mind. A woman may find that the equipment doesn't fit or work well.
It's funny. Our aunt was finding a struggle with her week at work. She told me her glasses kept fogging up because when her mask was on, the air was going up to her glasses and just fogging them up. She's having a hard time. So
yeah, it's like, when are women gonna win?
We'll never win. When will we learn? When will we learn?
No, I don't know. When are we gonna? Anyways, 63% of Canadians are concerned that women face more exposure to COVID given their respective high-risk service jobs. So again, groceries, nursing homes, and personal support workers, for instance. So even when you go, because I notice that when I go in the grocery store, the guys are outside wiping carts. Mm-hmm. And the women are inside behind the plastic shield doing the cashiering.
And those plastic shields are bullshit. Sorry and pardon my French, but they are. Like, the next thing they're about to do is lock them in a box. Like, it's just ridiculous.
Oh my gosh. Just thinking about this is exhausting. Don't worry, we're almost through it.
What are they doing to us?
So the economic impact on women. This was the one I was telling you guys about earlier. During the week of March 15th to the 21st, employment dropped by 298,500, or 5% among women ages 25 to 54.
Oh my God.
Which was more than twice that of men. Months later, 59% of Canadians are concerned that women in Canada are still at higher risk of losing their jobs due to COVID-19.
So just under 2,000 men lost their jobs?
Yeah.
Wow.
So 298,500 is what lost for women. Mm-hmm. And
I did the quick math. It's just under 2,000.
You're like, listen, I went to Kumon.
I could do the quick math.
Where learning helps you learn.
1 + 1 is 2. -1, that's 3. Quick maths. I feel like I came with the rhyme wrong, but that's my favorite one. I could do quick maths. Okay.
Anyways, aside from industries shut down by COVID, women are also make up the majority of people who are in minimum wage work and part-time work. So that was everything in March. That explains the numbers right there. So the minimum wage jobs and the part-time jobs, because I was at minimum wage, but I was part-time, just for an example. They're precarious, at the best of times. Like, they're not solid jobs to begin with, so they were the first to go.
Of course.
Basically.
No furlough. Just
no
go about your
furlough.
business.
Just go. Thanks for coming
Thanks
out.
for your
We'll call you
time.
when we reopen. Yeah. So
If we're still a business after COVID, we'll give you a call. If we haven't permanently closed, we'll give you a call.
and this is another strange. This is not. It's not a fun. I hate the word fun fact. This is a fucked up fact.
There we go. Yeah.
That's what I want to say. I want to
Yeah.
say fucked up fact.
I'm cool with
Poverty in Canada is already gendered. Women make up 60% of those Canadians who are economically struggling, meaning that they report difficulties covering basic expenses and may need to do payday loans or go to food banks to get by.
I've lived that life.
So this is like,
I have lived that life. I have loans upon loans upon loans that are in collections. I have no shame to say it. It's true. I've lived that life.
I just like,
But there's no.
what have I been?
There's
this
only
whole
one
time?
way up when you've reached rock bottom.
Climb to the
So.
top. Just claw your way out of that shit.
You know. So
No, I feel so almost like it makes me feel unaware that this has been going on, and I didn't. Like,
honestly,
I live
until
in
you're
it. I
put
live
in
it. I am one of these people, though. It's the thing. Like,
but until you're put in actual situations where you have to be faced with these types of things, like, you can be oblivious to it, and you don't have common sense either. So I mean, you're
that's true.
you
That's
go
not
through
always
life
that
with your
common.
head down, pretty much.
Yeah,
but your
my
head
head
high.
in the clouds.
Yeah, your head
My head
high in the clouds, not
Yeah,
even down,
like,
just high in the clouds.
yeah, just in the
So,
clouds.
But
No, it's just like, that's just a staggering number. And you think about it, it's not just families, it's single moms like
Yeah.
you, for instance. And
that's why I'm
you
like,
know,
I've been there. I have been there where I'm going payday loan to payday loan. I'm at a food bank. Like, I've done that.
and this is what's going on right now
And you
during
should,
the pandemic.
You should, yeah,
Like,
and you should see, and that was before the pandemic. So that's what I'm saying. Like, you
people
should
must
see.
be going crazy.
I remember the first time I ever went to a food bank. Like, I saw women that were coming straight from their jobs in business wear. Okay, like, these are people that, like, it's expensive. Like, life,
live, yeah.
it is expensive to live, and it doesn't help, when men make their own money and go do what they want with their money. And
It's not a man.
don't-
No,
yeah.
no.
This is
Don't
a
worry about.
man's world.
It's a man's world. It ain't nothing but either woman or a girl. So
Yeah, just
that's how the song goes. So speaking of being a man's world with women leaders, how are those women leaders playing a role in Canada's response to COVID-19?
they're standing proud and strong, and they're doing the damn thing.
There's apparently 10 of them. I'm not giving you all 10 names. The one name I was mentioning before was Theresa Tam. She's the Chief Public Health Officer of Canada.
Chief.
The boss. The boss.
She's the boss lady.
She's the boss lady. But at the same time, it's also important to remember that the other boss bitches that are out there are those essential
Ladies,
workers.
my gosh, we're not calling you women.
No, you know what I
Derogatory
mean.
names.
You know what I mean. I'm a boss bitch, so I could say that. Like,
Okay,
you know
fair
what
enough.
It's all coming.
I just
from
wanted
love.
to, do a little,
like,
do a little
do a
clear
little disclaimer.
disclaimer.
But like all the other girl bosses, sorry guys, I apologize for using the word bitch, but all the other girl bosses out there, they're the essential workers. So they might not be in the spotlight, but they're out there doing their thing, right? So
Doing their thing and taking care of their kids or their families, wherever it might be.
and it says with these women leaders, seeing all these women on TV talking about the pandemic, giving us our information, our daily dose of news and hope that things might be changing soon. They're blazing trails.
I ain't never seen so many black female doctors on CNN in my
Never
life.
in my
Black Lives
life.
Matter, and we just
Female
getting it
lives
in there.
matter.
Female lives
We're
matter.
like, yeah.
I've
all of
never.
that,
Every
all
time
of
I
that.
come and look on CNN, my dad's watching something, I'm like, "Girl, get it." I never seen you before. Where'd you come
Honestly. But we're blazing trails. So these women are emerging as diverse role models, particularly in the STEM, which I think stands for science, technology, engineering, and math, if I'm not if I'm wrong,
I feel like you're right. Mathematics, maybe not the short form.
Mathematics.
Yeah.
Email me and tell me I'm wrong. I didn't look it up before I got on the show. I'm sorry, I was irresponsible.
She's pretty sure she's
but
right.
I'm pretty sure I'm right. Can motivate other women and girls to pursue those roles because there's not enough women in STEM. I've been hearing this for years.
Go watch
and years
Hidden,
and years
Hidden
and years.
Figures, ladies.
There's
Go watch
not
Hidden
enough women in
Figures.
STEM, so
we could do anything.
More diversity in leadership helps break down stereotypes about who and what makes a good leader, which is really good. You know, seeing all these women, because, you know, people think that like, oh, women are going to be all like emotional and we're going to lead with our hearts. Once a month, and not we're going to bomb the country. We're going to bomb. We have the codes, you know, who knows what we're going to do when we're PMSing. Like, you know, these very narrow stereotypes about women in leadership. And I feel like
we'd go eat a tub of ice cream and cry in our rooms before we bomb anything. You know?
Exactly.
So I mean, just if you wanted to know,
relax. Like we call
eat some chocolate, some sugar cookies.
We'd phone a friend. We'd go on a girls' trip, get wild, you know, something like that, and then come back and make some decisions. Like that's what girls do. That's but all. People have this narrow view of like what women leaders can do, and to see these women on the news being so cool and calm under pressure, our young girls are seeing that and looking up to that and thinking to themselves, I could one day affect change like these women are affecting change. Mm-hmm. So I think it's really important that these leaders are, you know, these women leaders are out there, you know, and are visible during this like huge, you know, global crisis.
You want to know something so funny? The only African American female that I remember, and not even American, was Condoleezza Rice. That's the only one I remember. Like that was the only like maid role model that you felt like you could potentially be in the government. Like you could be working at some type of level of government. Mm-hmm. So take heed, young women.
Take heed. And finally, how is the pandemic affecting women's mental health? How's it affecting your mental health, B?
I mean, it's a kind of like an emotional roller coaster. Like 1 minute I'm up, another minute I'm down, then I plateau. I'm on a bit of a gateway high right now. I'm getting up there. I'm hoping I don't drop too low. Mm-hmm. But I'm at a good. I've come to terms that COVID's not going anywhere. Basically, yeah, you know, like I've come to terms. Like my kids are not going to school. They're not going to childcare. Like I'm gonna have to figure out other means of entertainment and exercise. Like I've come to terms. Like, and I'm okay with it. And I think The Handmaid's Tale is coming to real life. Just saying, you know,
like my gosh,
they're taking away the post. They're taking away the postal service from America. Like soon, we're not going to know anything. We're not going to get any mail, any bills, because they're going to kidnap people and start making women bear children.
Stop.
Look at what they're doing to us already. They're taking all our jobs.
You're spinning. You're spiraling. You are spiraling.
Whoever watches Handmaid's Tales, they know. Email us. You know what I'm talking about. It's happening.
Conspiracies. No. Anyway. Conspiracy theories. It says that there was a poll done. I always love a good poll.
What is the difference between a poll and a survey?
A poll, I don't know. Elliot, look that up. 49% of women report feeling very worried about the outbreak compared to 33% of men, indicated a poll by Abacus Data. Contracting the virus compared to 64% of men. 75% compared to 64 of men. Okay.
Of course, we worry
because we are the bearer of children,
Yeah,
not
we
me.
worry.
I'm not barren, but I haven't bared anything yet, so I don't know if I'm barren. I could be.
Oh my god, what's wrong with you? Spiraling.
An April 2020 survey suggested that more women than men reported feeling anxious and nervous very often due to the pandemic, and more women than men reported difficulty sleeping very often since the beginning of the pandemic. So women aren't sleeping.
That's just our nature.
They're stressed. Like,
that's just our nature. That's like, the first day of school for a teenager. Like, guys aren't stressed about the first day of school. Girls are stressed about it. Like, being a mom, like, dealing with your kids, like, we're stressed about it. Like, women in the workforce, like, you got to deal with the men at the job, you're stressed about it. Like, these are just things. So COVID adds a whole new element to be like
all of it,
to all of it. So
for sure.
And when you work with people that don't care,
no,
you're fucked.
You're fucked. Oh gosh, that was a very heavy episode, and I didn't think it was going to be that heavy.
Yeah, when you were doing it, obviously.
When I was doing it, but now that I talk about it, I really have to go reflect on my womanhood, like, and who I am as a woman at this point, because
you're a woman.
WOMAN doo. I'll say it again.
Yeah, just reflect about it.
Yeah, I gotta reflect on being a woman because some of these statistics were jarring. But I think one of the biggest takeaway from this whole episode for me was the fact that we may make up 40% of the income, but we make up half the jobs. So, and She-Covery can happen.
Don't mock the woman word.
Without childcare. So I think we need to start, like, again, this goes back to the episode we did last week. Was it last week, the childcare episode?
No, that was Kanye.
So it was Kanye. So the week before that, if you haven't listened to it, shame on you. I'm just joking. Just go back and listen to it. But we talked about the schools. Like, it starts with the children. Like, I believe the children are our future. Teach them well and let them lead the way.
And we can't let them lead right into COVID, people. It's not safe.
Yeah, like, it's not safe. So we need to focus on things like schools, childcare, like getting those things up and running, because those are the things that women are concerned with.
Like, we're not trying to shit on the guys, but like, you guys will be okay.
You're fine, and
if you follow the rules.
Exactly.
Like, wear your mask.
You're
Don't
fine.
think you're
your concerns
invincible.
are the house, the finances, all that. Maybe that's your concern, whatever. Maybe you are concerned about your children. I'm not saying that you're not. What I'm saying, though, is women have that extra added pressure when it comes to things like having children, being single moms, having a family. They have to think about, I say deal with because I don't deal with it, but they have to think about everything and every element, every piece of the puzzle.
Our anxiety gets high.
And the anxiety obviously is going to get high, which is going to increase the mental health 54 to 163%, the ridiculous fact we mentioned before. Like, it's going to all increase. So, focusing on childcare and health and making sure the education system's shored up might help the women's situation, because
in turn helping
we can't
whatever
go
men's
backwards.
situations there
are. Yeah, we can't go backwards. We're not going back to 1945. Like,
the women aren't going to be making you bacon and eggs in the morning while you go to work, fetching your newspaper and sending the children off to school.
And sleeping with the milkman behind your back.
No,
that's not happening.
No. Well, I don't know about all that, but no. Like, the milkman, postman, whoever, man, we don't know.
Not
but
the
like,
postman. Trump took him away.
Oh, well, there you go. So you're limited in your choices, but to each his own.
Sorry about all the Trump references. Our dad really does watch CNN all day long.
He watches CNN on a constant basis.
Oh my gosh. Anyways, that's been the episode. So if you want to reach out to us, men, women, whoever,
I was just gonna say before we sign off, I was gonna say I feel like we're a little bit disposable. In this world, us women.
No, we're not. We're the cradles of life.
Of course we are, but like, they're trying to treat us a little bit like we're disposable. All these jobs are taken away from us.
No, they'll learn. They'll see when the whole thing comes crashing down on top of their heads.
When it goes to shit.
When oops goes the daisy, they'll know.
When everything hits
they'll
the
know
fan,
when shit hits the fan or the fan hits the shit.
whichever one come first.
They'll know about women needing women in the workforce. You can't go back.
Disposable. We're not gonna take it.
No, we're not gonna take it.
It's my favorite one.
We're not gonna take it. Yeah, like, anyways, with that said, are you good?
I'm good now.
Okay. All right. With that said, B, let them know how they can reach us if they want to talk about this issue that we have, the pandemic and its effect on women. If you're affected by it as a woman and you want to share with us your story, your struggle, your journey,
especially if it's affecting your mental health.
Especially if it's
we want to hear about it.
So please do reach out to us. B, tell them how they can reach us.
So you can reach out to us at dysh@daintydysh.com. So that's DYSH@DAINTY DYSH.com. And if you're listening to us on Apple Podcasts,
give us a 5, deserve 5.
And if you're listening to us on any other platform or streaming service, thank you so very much. Like, share, and subscribe. And if you want to get a hold of both me and Onika on Instagram, our shared Instagram is Dainty Dysh Podcast. So that's DAINTYDYSHPODCAST. And if you'd like to get a hold of me individually, my Instagram is thatmuvabadxo. So that's THATMUVBAD. And if you want to get a hold of Onika,
it's Best of Onika. That's BESTOFONIKA.
And if you want to get a hold of L, his Instagram is it's
LO.
So
that's ITS.ELLO.
I'll get the spelling down. Don't worry, guys. I'm the spelling bee champion in this bitch.
Of course you are.
And I think that's everything.
All right, guys. To all my women out there, I love you so much.
You are survivors. You not gonna give up. You not gonna stop. Oh, that was your song back when I was little.
You go ahead. Harder. You're survivors. I will survive. No, as long as I know how to love. We're adding a musical element to this show. If
I know.
You don't like it, if you like it, let us know. If you don't, who cares what you think? But with that said, that has been the dish of the day, and I hope y'all have yourselves a very, very, very happy hump day.